Good afternoon, everyone. Thank you so much for joining us for our second of several town halls as part of Families Together's Family Empowerment Month of 2022. As many of you know who participated last year, we had a Family Empowerment Week where we had very successful town halls giving legislators and commissioners from various state agencies the opportunity to address families and young people with lived experience in those particular systems. So today we're delighted to have our mental health chairs in both the Assembly and the Senate and our commissioner from the Office of Mental Health joining us to address our families and young people and to take questions from our families within that have experience in this system, mental health. I'm Paige Pierce. I'm the CEO of Families Together in New York State. And of course, we're the statewide family-run, family-governed organization that represents families of kids with cross-systems needs. And we also have an opportunity to have youth power, which is the youth voice. And our philosophy at Families Together is nothing about us without us, meaning that we have lived experience that we can bring the expertise to the table to help legislators and state agency folks best do their jobs if they can be responsive to stakeholders, and we are those stakeholders. So we're here today to address the commissioner and the chair of the mental health committees in both the Assembly and the Senate. So I'm going to introduce Assemblywoman Aileen Gunther first to just say hello.
Good morning. My name is Assemblywoman Aileen Gunther. I'm a registered nurse. I worked on mental health units in Catskill Regional Medical Center. I know that as many as 1 in 5 children aged 13 to 18 has very serious mental health problems. I know that these children are struggling. When we commit to caring for children and mental health, it benefits our entire community. The bottom line is that in my community and what I hear from people around the state of New York is access to care. That's one of the biggest, access to a psychiatrist. When the number of days that people are admitted to the hospital, they're started on a medication, the observation period is too short. So a lot of times the efficacy is not there. I think that long-term help for people also is lacking in New York State. Supposedly we're a very rich state, and this is a community that continues to suffer. And, you know, I've heard from every news reporter, every teacher, I've heard from citizens all over the New York State area that more and more children are having anxiety orders and mental health disorders over this pandemic. And I would say that there has to be more focus. I mean, I feel that I am a fighter. I feel like I fight for money. I feel like in my conference, I make it a subject that I continue to promote every day. I think that a lot of times, you know, at this point, we have Andrea Stewart-Cousins, we have Carl Hasty, and we have Kathy Hochul. And as we go, you know, I know we've put more money in the budget, but I also think that the important part of money is making sure it gets to the right places and it flows downhill. And making sure that when we create new systems or new organizations or places to go, it has to come from the community that asks for it. Like, in other words, when we talk about the Black and brown community, or we talk about an upstate community, I mean, there are different needs in every community, and that always has to be put into the equation. And I sometimes think that we lead from the top down, not from the bottom up.
Thank you, Assemblywoman. And also with us today is Commissioner Dr. Ann Sullivan, who has been the commissioner at OMH and an ally and friend for many years to families and young people. Commissioner, welcome.
Thank you so much. Thank you so much for having me. And first of all, again, I always want to thank all of you for what you've done these past 2 years during the pandemic. You know, you've been there for youth and families. You've been such a critical part of our system of care. And I can't thank you enough. And I know you've all, just like all of us, have had our own personal struggles through this time as well. And but thank you so much. You know, as Assemblywoman Gunther said, this pandemic has affected all of us. And I think as we come out of it, access to care is a critical issue. I honestly believe that this budget offers us a lot. I think that Governor Hochul is very committed to youth and families, and that this budget is pretty rich in terms of services. It doesn't solve everything, but it gives us a lot. And when I looked at the things that Families Together and youth were lobbying for, I was able to tick off a number of them that were in the budget. And I think that that is really a credit to all of you for your voice and your advocacy and for being so strong, and in terms of government and our governor and us all hearing you and understanding how important those things are. So I won't go into them now because I'll probably answer them in some of the questions that you have, but I do want you to know that your list of asks, many of them were fulfilled, and I want to thank you for your advocacy because you were an important part of making that happen. Thank you.
Thank you, Commissioner. And I meant to say that at the very beginning. I actually texted Brad and Zach yesterday and said, remind me to thank the Commissioner for the governor's budget proposal. This is by far the best budget we've seen in a very long time, probably in my career. And I've been here for over 20 years. And I mean, it used to be, there was a time when we used to advocate to just get the governor to say, and this was several governors ago, but to say the word children in his state of the state. Like really, we were like, please, oh please, and it didn't happen for many, many years. So we do appreciate the advocacy over there at 44 Holland Avenue in Albany. And Senator Brook, thank you so much for joining us today. I just wanted you to have an opportunity to introduce yourself before we introduce the ambassadors that are going to be asking us questions today.
Great. Thank you so much for having me again. This is a wonderful tradition that we've started. Of course, I'm the newest one to the group probably here, but it's always a day we don't want to miss. And it's so good to see my colleagues in government and of course, the parents and advocates. You do the work. We're just here to kind of take the relay, when you bring it to Albany and hopefully try to get it finished. So for those who don't know, I'm Samra Brook. I represent part of the Rochester area here in Western New York, and also the very, very proud chair of the Senate Mental Health Committee, where I get to work alongside my Assembly counterpart, Assemblywoman Gunther. And I think I just wanted to share quickly to set the stage as I'm thinking about this work in my second year as a senator and as my second year as chair. I think you, Paige, you said it so well, right? We are starting from such a different place than we have started from even last year. And so for these to be my 2 years to compare, let me tell you, there is quite a delta between where we were this time last year and where we are now. And I am certainly grateful to the work of the commissioner and her advocacy, and a governor who for the first time has understood where need is greater, resources must be greater. I think we have come from a world in which as need increases, funding and resources have depleted and decreased. And so we are finally on, I think, in the right direction. That said, I think that there's still a lot of work we need to do. And frankly, I've been sharing this story with folks because I got a heart-wrenching letter from a student who isn't even a constituent of mine, but found my name, I assume, because of my work in mental health. A high school student sent me a letter last week begging for help, basically, saying he's not sure what's going to happen to his classmates. He sees that they all are just so traumatized. They don't know where to get help. And many of his friends he shared have started drinking. And he literally wrote in this letter that they now drink multiple times a day just to get through the day. And as we know, many of our students haven't been able to be in the classrooms, and this can be really, really difficult on top of everything else they're dealing with. That tells me that we're making strides, and I think we know that, but we have still not fulfilled our promise to children and to families in New York. And so I'm committed to continuing to do the work we need to do, whether it's passing more bills, whether it's fighting for more funding, whether it's really holding our agencies and ourselves as legislators accountable to make sure that those resources are getting to the people who need them most. And I think we have a moment right now. We have a governor who seems amenable. We have a crisis that is on everyone's minds. We have a Surgeon General that has declared an emergency for youth mental health. If we cannot get it done now, I don't know when we can. So I am with all of you and so grateful, Paige, for your work. And I saw someone popped up, but I guess he's gone now. But I thought Brad had popped up for a moment. There he's back. Okay. and so many others of you. So we do have our work cut out for us, but I am very much looking forward to getting into this conversation with you all. So thanks for having me.
Thank you so much, Senator. And, while I said earlier, we have 6 different town halls throughout the month of February, because we have 6 different state agencies that all have touch our family and children's lives. We also are really eager to have more integration and collaboration and coordination amongst state agencies, and even merging of some state agencies. When you talk about kids who have behavioral health issues going on, it's not just mental health, it's not just addiction, it's both. And so we've been urging for years for there to be more collaboration and coordination, and especially amongst those 2 agencies. And we had our town hall yesterday for addiction. And the reason that we have the separate ones is really to give the opportunity to the commissioners and to the chairs of those multiple committees to address. And we have families on our staff, in our membership, and young people who are involved in these different systems. And so you're going to hear today from some families who specifically are, and young people who are specifically involved in mental health. So I'm going to turn it over to Mona, who is going to introduce herself and moderate the whole panel. Mona.
Thanks, Paige. Hi, I'm Mona Ghanem. I am currently a parent advisor for New York City Regional area, working out of the Office of Mental Health, but obviously we're all working remote these days. I'm also very happy and proud to say that I am going to be the Director of Workforce Development at Families Together in New York State. I'm working towards that, as our current director is going to retire, and I'm thrilled to be taking on that position later in the year. So today we have on Zoom with us some ambassadors who will each pose a question that is relevant or important to them. So it may seem personal, but these questions are also representative of our communities. I love the way that you have given us this opportunity to make this forum a way of approaching the universal through the personal, because these issues are endemic to the state, to the nation, possibly even the world. So I'm really interested to hear what people have to say and question, and what some of the responses are going to be. So with that, I will pass it on to Sarah Taylor to introduce herself and ask the first question.
Good afternoon, everyone. I am excited to be here for the first time to be a part of this great town hall. Thank you, Paige, Daphne, and the entire team, and Brad. So I want to jump right in. My name is Sarah Taylor from Rochester, New York, and founder of the BIPOC Peak project, which is a movement, I should say, specifically developed to help our Black and brown babies and parents, empower parents in elevating our voice to address inequities that are our reality every day. So as I ask this first question, my question is related to right now. We know there's a lot of great legislation on the table, and I thank you, Senator Brooke. We have worked together so often, and I was humbled to receive your Woman of Distinction Award. So I'm so excited to partner with you and to hear from you today and the other leaders here. So my experience as a Black parent, BIPOC families' experience is very, very different in the mental health system than that of my white peers. But increasingly, we are seeing young people of color at an increased risk of suicide and in heightened levels of crisis. What else is going to be done on a system level to engage low-income BIPOC families in culturally responsive care that center around grassroots prevention. And furthermore, what is New York going to do to ensure the 988 crisis line is more than just a number to call, but has the accessible resources behind it to help young people of color avoid police interactions? I know firsthand at getting a resource sheet from a hotline, many times I didn't qualify for 9 out of 10 on the sheet. So I would like to know, what are we going to do in this right now moment to help our families, our children that are in crisis?
Unless you give us an order, I'm going to jump in, Sarah.
Jump right in.
Because I'm glad you recognized yourself as woman of distinction, because I was going to, if you didn't. I just have to take a quick moment of privilege that I am so proud to have Sarah and her organization and the work they do here in the Rochester area. And we are so grateful that you are such an advocate for not just your family, but every family throughout Rochester. So thank you. As you are not surprised to hear, you just touched on one of my top three, actually two of my top three priorities as chair since I came in. One is reforming our mental health crisis management system, and two is getting culturally competent, responsive, linguistically competent care. And so everything that we have done through this committee, whether through the budget or legislatively, has had that lens. So there are several things that we are doing on a systems level, and I'm sure my colleagues will add their pieces of this as well. The first one, I think we need to put a fine point on it, Sarah, which is Black youth suicide attempt and the rate of it in our state right now. I sit as one of the co-chairs of the Task Force on Opioid and Addiction for the Senate. And one of the things that came to light in October during one of our hearings was that while suicide rates haven't necessarily exponentially been increasing, the rate of Black youth suicide has. That's a major problem. And what that tells us is that what we've done historically is clearly not hitting the mark, or it's not enough, because we are losing our Black children. So this week we passed, for the second year in a row, our Black Youth Suicide Task Force bill, aimed explicitly at looking at that issue and taking into account the experiences of our parents and families who are experiencing that. I like the way you said we need to center the voices of people affected. It's not enough just to consider these voices. They must be at the center of our policy decisions. The other piece that's going to affect this is Daniel's Law, which I know you know here in Rochester is something that's top of our minds always as we come up next month on the 2-year anniversary of Daniel Prude losing his life in an altercation with law enforcement. And of course, he was a Black man in a mental health and substance use crisis. One of the key pieces of that bill is having a state council that is representative of the people who need that support most, to make sure that we are making the right decisions policy-wise. There's another key piece of the teams that are showing up, making sure they have lived experience, that they are peers, that they have family members or themselves have gone through mental health challenges, because you cannot replace that kind of experience. And to take it further, to say they're also representative of the communities that they are serving. And the last piece is also, you talked about 988. Obviously, I'm proud to have gotten that signed by the governor last year. And now, of course, the commissioner will talk about how the implementation will look. But key pieces of that legislation had this exact piece in mind. First of all, we were gung-ho about the fact that we include training for populations that have been historically left out and not served in the way they need to be. That includes BIPOC, that includes children, that includes LGBTQ folks who have often not had the culturally responsive care that they need. We want to make sure that that is central to the training for those who are picking up those phone calls and have those resources available. And the second piece is that we are messaging to make sure people know to call, right? What good is a number that is, quote, easy to remember, even if you have it fully staffed with culturally competent counselors, if no one knows to call. So another key piece in that legislation was ensuring that not only will there be PSAs, but there would be concerted efforts through this 988 line to ensure that we were reaching these populations that, as you have said, have often been left out of getting these resources and understanding. And the last piece is we need to diversify our workforce. And that's another way that we're going to make sure that we are reaching people who need it. And I have a number of bills, both on the licensing side, but also on scholarship side, to make sure that we are diversifying the people who pick up the calls, who show up to the crises, and people that have lived experience that can actually attest to some of the challenges that people are facing.
Thank you so much.
Thank you so much, Senator Brooke. And I'll just expand a little bit on what it's really very much aligned with what Senator Brooke just went through. A little bit about our added various points of what she's talked about. I just want to highlight one other thing, though. You know, we got a $100 million FEMA grant from for New York Project Hope, which was to do crisis counseling post and during the pandemic. We made a major effort, because this was new money and it was a new experience, to be sure that we could really be successful in reaching out and reaching members of the underserved communities that were the hardest hit by COVID. And the data shows we had to do a lot of grassroots work. You're absolutely right, Sarah. We had to be out there. We had to have, it didn't work. What was interesting is the emotional support helpline was not used by our Black and brown communities very much. That was used by the white community. And when we realized that, we said, there's something missing here. There's something we're not doing. So we did a lot of grassroots working with churches, working with community centers, working with everybody, got out there. And now the outreach of Project Hope, the vast majority has been in the Hispanic and Black communities. And we have over 50% of the work, the counseling numbers that we've gotten have been. So we've learned exactly what you said, Sarah, that this grassroots that needs to be there. And that's something that we're going to be doing the same way as we develop the crisis stabilization programs, et cetera, that Senator Brooke was talking about. We're in the process now of doing the call center. It has to be competent. It has to be people extremely well trained. They have to know the community services, and they have to be well experienced to be able to handle the kinds of crisis calls that will come in. Any crisis call can be answered. So it's not going to be, oh, are you eligible for this line or that line, or what are you? No, I mean, they will be responsible if that call comes in for connecting you to whichever piece of the service. Now that's a big ask, but we're going to make it happen. And that can be the crisis stabilization centers. It could be to clinic services. It could be to mobile crisis. It could be to a crisis counseling line, whatever seems appropriate. So I actually think 988, and thank you, Senator Brooke and Assemblywoman Gunther, I think this can be a game changer for the way we do business and letting people really get that first point of access is that somebody hears you, listens to you, and helps you get to where you need to go. And I think 988 can be a big piece of that. So we also will be expanding. So we have mobile crisis teams in every county, and we're expanding the hours and the availability of the mobile crisis teams. And the work with those teams and with 988 with law enforcement becomes kind of critical. So I think that the 988 crisis system, which will be for adults and kids, it's going to be set up. The stabilization centers will be organized so that they have special entrances for kids, special places for kids and families that are welcoming to kids and families. So we're really doing it. The other thing about the crisis stabilization centers is that we're doing it jointly with OASIS. So I know there was a page you had said earlier, what about this integration? And we haven't always been integrated by a long shot, but we're getting better. And one of the things we decided was new programs, we were going to work very hard to get them integrated from day one. And so those crisis stabilization centers are integrated. In terms of, just briefly, in terms of Black youth suicide, it is a serious, serious issue. And you're right, Senator Brooke, that the numbers have stayed about the same or gone down a little bit. perhaps, but not for Black youth. We have had a task force that has done some work, not enough, but some work in this area. And we're taking an approach to work with some of the Black churches in New York City and Harlem. And we're going to also be expanding that to some of the Black churches in Rochester, actually, is the next place. And this is an evidence-based approach that works with those communities to really set the stage for how to be able to talk about issues so that you don't get to the point where youth feels, and how do you do that in a Black community? And so one of the ways we've reached out, this is just one piece of the plan, but was to work with some of the Black churches, both in the Harlem area, and then the next phase will be up. And if this works, if this is successful, it's something that we would, as you said, Sarah, want to spread out across the state. And it's very specific work. We've tried in another piece in the school is called Inspiring Comfort, and it's really geared towards young Black youth in the latency ages of 9 to 13. And we're expanding out to a few more schools. It's again very Black culturally oriented and has been developed to work specifically with that population. And that's again in a couple of schools, and we're going to be expanding that. So those are some of the things we put in place on a broader scale in our suicide handbook that we use for schools and our planning for schools and all the trainings. Like, not that a training can do everything, but we are adding pieces of that training that really address all the key cultural issues. So just so you know that that's trying to be getting embedded as much as possible in pretty much everything we do. And then lastly, just to mention that you have to look at yourselves too. So I think we're looking at the Office of Mental Health. We're trying to see where we haven't been addressing disparities the way we should have. And we've come up with a dashboard of quality indicators that we're breaking down now by race and ethnicity. So we can say, are we serving our Hispanic and our Black clients as well as we're serving our white clients, or et cetera. And so I think we're trialing that across the clinic system at OMH. And once we get it refined, we're already looking at it, we'll be spreading that to the clinic system out in the community. I think data helps with this. I think it can help us see where we may not be doing the very best job. If we're in a community which is largely Black, are those individuals being engaged as well? You know, do they follow up? Do we help them make sure that their blood pressure is as well controlled as maybe a white client's blood pressure? Those kinds of things are things that get down into the nitty gritty, but I think ultimately tell us whether we're doing the right thing or not. And I think we have to look at that to be sure, because I know we're going to find disparities when we look at this, because we know that they exist in healthcare. And then just finally, on the workforce, again, with dollars that have come from federal government, a combination of that and things from the state, we're going to be reaching out to the schools of CUNY and giving some stipends, about $10,000 focused on minority students at Knudsen from our Office of Diversity, to be interested in mental health. And they would get that stipend to use however they wanted during their year of being in school. So they don't have to use it for tuition. If they have, they can use it just for anything they need as their expenses, as a way to entice the workforce. So that's just one workforce thing, but we need many, many more things like that reaching into the community. So I'll kind of stop there. But your point is well taken, Sarah, and we still have not nearly done enough that we need to do in this area. Thanks.
Thank you, Commissioner. Thank you, Sarah. Thank you, Senator. It'd be interesting to see these rollouts, and we will definitely want to engage and input and collaborate on all of these things. Our next ambassador, Kathleen, I'm going to turn it over to you to ask your question.
Sure. Hello, everyone. I'm Kathleen Liedke. I'm a parent advisor with Families Together in New York State in the Central Region. Hello, Commissioner. It's wonderful to see you again. The Commissioner and I was very blessed. I got to have a picture taken with her at the State Fair this year, so that was so fun, or last year now. And welcome, Assemblywoman and Senator. It's wonderful to meet you. I was a parent of a son with a mental health disease, condition, and addiction issues. And he passed away due to the complexity of his co-occurring disorders. So when we're talking about the integration of care, it's very, very close to my heart as to how we could really work on getting that more in the forefront of working with mental health and OASIS together to help individuals that struggle in both systems. I'd always felt that wherever my son was at, the staff did the best that they could to support him and to help him with his wellness. but that was either, one door was mental health, one door was addiction. And many times they didn't work together, they didn't talk together. I remember one incident where he was in a group for substance use, and because of his behaviors and his mental health diagnoses, he wasn't able to pay attention, and he basically got kicked out of the group. And the counselor really did not know how to handle his mental health side of things. So that was really a very difficult time for him. And I wanted to, we have a couple of questions in reference to the integration of care. And one of them was, why do we have youth clubhouses on the OASIS system, but not on the OMH system? And why does mental health challenges matter more to one counselor and not another? And I think what we mean by that is just basically, may not mean it doesn't matter to them, but they may not have that expertise to be able to handle both sides of the coin with that. When you have a person with a severe mental illness and a substance use disorder, I'm hoping that maybe some of the monies that are going to be available will go to training some of the counselors and some of the individuals that are working with these people that are struggling so desperately. And then we do understand that the merger was being considered for OASIS and OMH, but has since stalled. So what we'd like to see is these two agencies do, come to ensure that families like mine were getting the integrated care that they need and deserve. So we'd like you to speak on that, please.
Yeah, maybe I'll take that first and then Assemblywoman. A couple of things. First of all, yes, the merger isn't happening now. I've had conversations with lots of commissioners when we were thinking about the merger, about what it meant in various states. And some states, it helped a great deal. And in others, it really didn't make much difference. Everything stayed pretty much unintegrated, even with the agencies coming together. And what I learned a little bit is the integration has to happen on the ground. And I think I've already had conversations with new Commissioner Cunningham, who's very supportive of this, about how to really, really make that happen. So that we can kind of do, you're absolutely right, we do a tremendous disservice by having silos here. And it's not fair to our clients, it's not fair to families. And sometimes the care then isn't as good as it needs to be. It's just as you said. So yes, we have to do this. I think we're doing it. I hope we're doing it. I think going to be doing it with the crisis stabilization centers, where we both licensed them together. We've looked at it. If you come in that door, there's going to be everything you need for that center, both for substance use and mental health. And they won't be next to each other, they'll be integrated. I think the integration is a bit better in our CCBHCs, Certified Community Behavioral Health Centers, because they've been mandated to do it, because that's part of the way you get the money to be a CCBHC. And I think that sometimes, but they have done a good job. We're also working very closely with OASIS on a couple of collaboratives. This leans towards the mental health side. I'm sure Dr. Cunningham could talk on this OASIS side, where they work with us with about 400 of our clinics to incorporate opioid treatment, to incorporate, MAT for alcoholism, MAT for opioid, basically to have those things available and to have the our mental health staff trained well enough to do some of the counseling that's needed in the mental health clinics. And we're getting there. I think of the 400, I said 400, I think it should be 200. I overdid it, 200 clinics. I think of those 200 now, about 30, we feel have really gotten there, but we're still working with the others to get them there. We've also done a joint effort with OASIS in the EDs across the state, the emergency departments, in terms of how should you be discharging someone who's suicidal? How should you be discharging someone who's had an overdose? What should be happening? And come up with consensus guidelines that come together for both of us so that we know. So I'm not saying we haven't solved it, but we're getting there and we're taking it extremely seriously. And I think that over the next few years, you'll see more and more of that integration. The other thing is we have to talk with the schools. I think the schools still train people in silos. And so people come out and then we have to train them to be integrated. And so we're beginning dialogues with SUNY and CUNY, which are connected to us a bit, and how we can deal with that. There's individuals who are going on a mental health, in quotes, track. What does it mean? What do you need to know? So when you graduate, you don't suddenly say, oops, I don't know this. And then we have to do the training. The same thing with physicians, nurses, everyone. So I think that that's the other piece. You have to begin back a little bit even before you get to the services. I think that those are the key things relative to trying to come and work together. And we're going to have a work plan that will go out about how do we integrate. Single licensure will help. We're still going to be going forward for that. It's not in this year's budget. It got stuck a little bit last year, but we're going back to the integrated license is okay, OMH and OASIS. The single license for all three agencies is the one we want to make, which make even things even easier. But there is the integrated license. There's a variety of things we want to do to make it easier and easier to have the services. So please know that this is a major, and Commissioner Cunningham and I have already talked about it. And I think we're going to be really working on this going forward. And you keep our feet to the fire that we have to really make this happen, that this shouldn't just be taught, but we have to really continue to make all these things that we've started really work.
Thank you, Commissioner.
Thank you.
Assemblywoman Gunther, would you like to?
Well, I absolutely believe that, OASIS and OMH, that is a great idea. I'm going to talk a little bit. I know I'm chair, chair in the New York State Assembly. But one of the most, in my community, we have a lot of problems with drug addiction, dropouts, mental health issues. Do you know, in my community, and it's a community of, we have a large Latino community, we have a large Black community, we have a lot of poverty, and child psychiatry, to get into a child psychiatrist, the access to mental health is incredibly important all over the state. And, merges are very, very important. The other thing that we did was the 988 number. I mean, we had a lot of ambulances going to pick up people that did not have any idea what they were walking into or how to deal with somebody with a mental health issue. So I think we're moving in the right direction. I think that, again, that we have to look at each part of the state of New York and find out what works for them in different communities. As you go upstate, we have no psychiatrists. In my community, there's tons and tons of poverty. There's no transportation. There's a lot of issues. So we are moving forward with 988, which I think is tremendously important, that we're making sure that in communities like mine, the first person that often shows up to a door is a police officer, which is, the training for police officers is very important in parts of New York State. And I think at this point, and I don't want police officers to be the first ones to, enter that door, but sometimes it does happen. And our emergency rooms seem to be the place where most people are brought. And, they've closed a lot of the mental health beds, as I said. So I think we're moving in the right direction. 988, increasing the monies. I think bringing OASIS and OMH together, because I think that they go hand in hand, that, anybody that's had a issue with addiction, counseling is necessary. So I think we're moving in the right direction. But sometimes I guess my frustration is, are we moving enough and fast enough? Because, every day we hear about somebody that has lost their lives. And, I'm one of those people, it's probably not maybe it's a little bit of my ADD, but I want to jump in faster. I want that education piece faster. I want, I talked to my friend Joe Finn, who is the Vice Chancellor of, she's my friend and she lives in my district, Vice Chancellor, and talk about how could we ever have done what we've done. And we live in a poor area. And that's the place, there's a few places that do have wraparound clinics that are associated with the school, but not in my area and not in a lot of places in New York State. And that would help tremendously. So when, the governor is adding money, I think the most important part is to look at different communities and look at the needs of that community and what really is most fitting for that community in order to deal with these problems, because we don't want to see another child commit suicide. We don't want, we want to be able to serve our community in a culturally appropriate manner, and all those things put together. I mean, I know that we're working on it. We have a separate team, but money helps. And also, I mean, money does help, and that's very, very important to be able to create these programs all over the state of New York. And we've been so starved for so long that we need a lot of it.
Thank you, Assemblywoman Gunther. Yes, absolutely. I'm of the same mind that it should have happened yesterday. So,
I'm frustrated every time you hear about another death. When you hear, and when I hear about someone going to the emergency room, inappropriate as it is, that they're discharged and they go back in and they overdose. And you know that there's something going on there. And, you know, we need the money and we need the professionals in our communities.
Tragic. Let's make it happen.
Thank you.
So we're going to move on. We have 2 more questions. Our next question comes from Zach. And Zach, I'll let you introduce yourself and pose your question.
No problem. Hi there. Hello, Commissioner. Hello, Assemblywoman. Thanks so much for joining us today. I live in Staten Island, and I am a queer young person who's also on the autism spectrum and also has several mental health diagnoses. Lesbian, gay, and bisexual youth are twice as likely to report experiencing persistent feelings of sadness or hopelessness, and transgender youth are twice as likely to seriously to consider and attempt suicide. What measures are being taken to address this disparity with their heterosexual peers, and what to protect New York's queer youth?
You know, it's I think this is something that, again, you know, should have been happened yesterday, but we're working very hard on it more recently. And one of the key issues I think here is educating the treating workforce. That really is still, I think, not up to par at all in understanding the issues that young LGBTQ plus individuals have to face. So there's a couple of things we're doing. And I think that we'll be spreading them even further. We've worked very closely on suicide with the Trevor Project, who's been our advisor, because they really know and understand, and they run a tremendously great crisis line. So they've been working with us. We've done a number of webinars, seminars. For Pride Month, we're going to be doing an intensive seminars that we'll be offering to the provider community on working with families and LGBTQ plus youth. So that I think that will be something to look forward to. It'll be in June of this year. We've also applied, you know, SAMHSA came out with some grant dollars that you could use for crisis training. And we talked to all the staff and we said, what do you think would be the most important? And they said, you know, the most important thing if we're going to do this right is to get some training for our LGBTQ plus group, for that youth. So we applied and we got it. So we've got some specialized work from a training grant. Then we'll be working with I believe it's the Center of Excellence in San Francisco. There's a Center of Excellence that does really great work. And we'll be working with them on the kinds of training that we want to do, again, for our mobile crisis teams, for the crisis stabilization centers, and for the 988 hotline that people will be calling, because we do think that that's critical. And we've also, in our school-based work, the team had put together for suicide prevention a very special module for this group. And that is also something that we've now been using in the schools. We've gotten some very good feedback on how helpful it is. Also, our school-based clinics that we're going to be growing. We have about 1,000 now, but we're going to be growing. We've done some work with them as well in terms of understanding this group, in terms of being able to work with them in the schools. So we're pushing it down into the schools, youth, and we're going to be doing some educating both for through the webinars for our providers, so that we can spread the knowledge here. And you're absolutely right. It's one of the highest risk groups for suicidal ideation, suicide attempts. And it's in those early teen years and going a little bit older, and we have to really make sure that our provider system understands the risks and can work well. And we also need to get more individuals in the provider workforce. You know, one of the things, the best people to work are individuals, whether it's of color, of gender, or whatever, to work with someone. And we need to work that. We need to also do some recruiting and get that workforce to work with us in mental health much more effectively.
Thank you, Commissioner. We are at time, but if we have one more question, and if Assemblywoman Eileen Guthrie would like to respond to the question that was just posed as well, if you could stay on for a few more minutes.
Sure.
Okay.
So what question are we, I'm sorry, I was listening to Ann. I'm sorry. So what
No, I was wondering if you wanted to respond to Zach's
question?
about
Are
the
you-
LGBTQ.
So, you know, at Ann Sullivan, the increased amount of money to this community to make sure there's education, and that education, you know, each physician has to take education each year for their license, and so do nurses and so forth. And I think a really great way, because we always have, I'm a nurse, so we have to take different classes, take infection control. I think that this would be a great class to add to things we have to do to keep our license. And I think that would be a really great way for social workers and really to spread the word, because we're taking these classes anyway, we're paying for them. And, you know, I think that we have to utilize what we already have and what we already do. You know, I just took 4 of my classes for my nursing license, and there's nothing like this in those classes. So if there was some way, Ann, that we could add that to all of the professionals as part of their license and their accreditation each year, that you have to take so many courses in order to get your license. I think this is a really great way to spread the word on all of these issues that make it part of the curriculum to keep our license. And especially with physicians, pediatricians, you know, there are signs and symptoms early on. And in order to go to school, you got to get a shot. You got to go to a pediatrician or a nurse practitioner. So we have to find the easiest way, in my opinion, to reach people and to let them know what's going on, and you know, talk about it. You know, the pediatrician, you go in, you go for your examination. And I think that, you know, to be able to pick up on these things are very, very important. And I really think that kids, they say, are getting diagnosed earlier. So to me, that should be part of that education in all of us, social workers, every one of us, as we talk to our children and our teachers. It should be part of their curriculum. They all take classes each year. And the more the people, the more you know. That they used to use that statement, but the more you know. If you don't know about it, and if you can't, and you're, you know, and you know, places like this, when I'm talking to you, I'm thinking about things that maybe I didn't think about before. And I think that it's a way, Ann, to do it.
That's a good idea. It's a good idea. I mean, we should look at that.
I think it'll work. It'll work because you have yeah. Well, I do, because you know what? You have a captive audience.
That's true. That's true.
And this captive audience is taking care of, you know, children, and we all go to the doctor. We got to get our shots. It's a captive audience where the conversation can begin.
Yeah.
Yeah, that's it. I'm starting a YouTube channel with the both of you, going back and forth. And our last, our last ambassador today, and certainly not our least, is Christina. You will be familiar with Christina. She is going to share a little bit of something that's going on with her, and then pose a question. Christina?
Thank you. I am Christina Houtman. I am a family peer advocate here on Long Island. I am also the mother of a 14-year-old son, Cody. Cody is biracial and also a member of our LGBTQ community. I sat in this town hall this time last year with you, Commissioner, and I had asked a question, and my question at that time was, how much longer do children have to wait for services? As you know, mine was waiting for a while for CFTSS, home and community-based as well. I'm now here a year later. He still has 0 services, but during this past year, he struggled with more hospitalizations, suicide attempts. He had another suicide attempt actually this day last week.
Oh my God.
While still sitting on wait lists. So to me, this indicates a real need that we have to address. It's a serious systematic issue at this point. But I have 2 questions for you, Commissioner. One, how do we move beyond waiting lists and start getting families and young people the help they need when they need it in that moment. Because again, you know, you're familiar with my story, and just from last year speaking and the awareness, we've gotten nowhere. I still worry, am I going to find him, you know, alive or not?
No.
So that would be my first question. My second question, though, would be, I know, Commissioner, you're very involved with us, invested in change and help. Would you be willing to meet maybe quarterly with other members of Families Together and Youth Power, so that, you know, to hear our concerns and help your system respond better to what is going on, instead of like an annually, or even with the regional committee part of it? Because there is so much, I think, like we're talking about different regions of going on, and just to bring back awareness to you, because I don't necessarily, and I think many of us don't feel it's an issue with you not addressing it, but maybe it's just things that the state's not aware really is going on in each region.
Yeah, thank you, Christina, and I'm so sorry. You know, again, you know, I know last year I'd asked, and I know we spoke with you after the town hall, but if things are still as difficult as you want, please, you know, let me know, and we can again talk about. And I'm so sorry. I'm so sorry. So anyway, let me just answer two questions. First of all, yes, I'd be glad to. So please just let me know. I'd be glad to meet anytime. So I always learn from these sessions, and we do bring it back to, and sometimes good ideas have come from here and we've been able to implement them. Sometimes we haven't been as successful as implementing them, but we always get good ideas. And so I really do appreciate it, and I'd be glad to meet for sure. On the wait list, you're absolutely right. We have too many wait lists, and we have too many wait lists across the state. I think that some of what is in the budget will help with that. I don't think it will solve it entirely, but I think it will help. One of the big asks that we made was for home-based crisis intervention services that were could serve about 1,300 families. And we now are doubling that this year, which is a really big movement to 2,600 families. So it's, that's in the budget, $21 million. We're going to be opening up 20 youth act teams across the state. So instead of opening 1 or 2, we're going to have 20, and we're hopeful that that will also be able to assist. We're definitely strengthening through the advocacy of everyone, including like Assemblywoman Gunther, others. The 5.4% COLA is something that will help, and also other ways to increase clinic rates that are involved in various machinations that I think will help the clinics to be able to expand more. You know, we have had a 10% increase in clinic utilization since the pandemic, which is good. But I think we've reached kind of the peak of the expansion at this point. A good percentage of that was actually for child services, but we're not expanding. It's kind of slowed down. Partly that is finding workforce. But also paying workforce. So I think the things that are in the budget in terms of the 5.4% and other enhancements that are out there in terms of staffing enhancements will help us. There's also dollars to expand intensive outpatient for kids, which has not been taken up as much. And then the CFTSS services. There's a 25% increase, which will continue. The 25%, and we're fighting very hard to make sure that that stays as a permanent increase, but it's certainly there for a while out of some of the other FMAP dollars and other things that, and we're looking at there's also some dollars to educate and move the CFTSS services. They have not been utilized to the extent that they should be on the child, so on the youth side, on the mental health side. The foster care system has done better with utilizing them, and we're working with our providers. They feel the rates aren't what they need to be. I think that 25% will help in terms of making those more available and making sure that that stays there. When we increase the inpatient rates for youth, and inpatient, we don't want to have, you know, people inpatient, but when you need to. About 2 years ago, it stabilized what was a closing down of youth beds. So again, having the rates where they need to be and in the right place, I think is very, very important. So we're going to be working with CFTSS Act, HCBS, systems of care grants across the state. RTFs, we're giving a significant amount of dollars to stabilize the RTFs. Too many of those beds closed. And we're going to be, and the CRs, that would have the opportunity to do higher level care. So there's just a number of things which I think will help the access. There's also where I work with parity, because I've been talking access and Medicaid, but access is a problem in the middle class as well, in terms of getting access to services, because basically insurance companies aren't as helpful sometimes in getting appointments for people and making sure that their networks are as robust as they need to be. We found that out through the parity work. So for insured families, commercially insured families, some of that is also a lot of work that we're doing, because there's a gap there in terms of the ability to have services. And then I think that the stabilization centers, et cetera, will help, but they're a bit down the road. But I think some of this infusion of dollars, and then the work to kind of gain the workforce. When I talk to providers now about, some of them say, well, we could we get people, we can't get people. And some of that's salaries, but I'm not sure it's everything. I think some of it is the pipeline isn't there. You know, the people to really even take the jobs. So I think that we've got to work on that. We've got to get people into the field and pay them well, but get them into the field and move them through the field, because that's another thing that's blocking us in terms of the needed expansion of services. So you're absolutely right. And we shouldn't have wait lists, but we're doing lots, I think, to try to improve that at this point in time. But I wish I could say that'll solve it and we won't have any more, but I can't say that. But we're going to try very hard so that you don't have to go through what you've been through.
You know, McDonald's is paying over $16 an hour right now.
I know.
So when you think about what people do in this field, I mean, they maybe make $17 or $18 an hour, 20, maybe.
Yeah.
I mean, I mean, that's, and you know, a lot of people that work there are of course women, but I think, you know, that we really have to look at, you know, wages too. I mean, you know, there are those that are completely devoted to this work. They love it. But, you know, I've heard people say, I can't do that anymore because I need to make more money. And I think, you know, that's one of the big issues. And I think there's more women than men. And it's one of those things that it's almost like this, they're, you know, when they talk about, you know, kids with disabilities, people with mental health, you know, they're in the shadows a lot. And, you know, we have to bring them out of the shadows. And, you know, I think that, you know, the financial thing is very important. And I've had people call me and say, you know, why would I? I mean, people love their clients. They do. They love them. They love them. They love their family. They want a roof over their head. So sometimes, and you know, the fact of the matter is, you're right, we can't get people to work in that profession. And what's happening now is that people are doing doubles and they're getting burnt out and then they leave the field. So we're up against a lot of issues right now, and I don't know how to, you know, solve it, or nor do you, but we've got to do something. I think money draws people in, which is, you know, there's a devotion to it, but I also think it's a money issue too.
Thank you. Very.
In the DD community also, the
Yes.
same thing.
Same.
It's the mental health and the DD community, and a lot of it has to do with salaries, and we just need to, I mean, we need to shake somebody up and say, you know, they save lives and they're working with people and keeping them alive and keeping them happy and keeping them safe and keeping them in their homes. There's a million things you can say about it, but I think, you know, maybe Kathy Hochul, you know, you have an ear for her. You have her ears. You can talk to her more face to face than I can. And, you know, honestly, we should think about the money aspect of it. I know we've got more from the federal government, but that's not going to last. We have to have a long-term commitment.
Absolutely. Thank you both. I love this volleying back and forth. I tell you, I could watch it all day. It's better than the US.
Great. Person.
We're going to bring you back for something.
You know,
thank you again, everyone.
I just want to say, I love the fact when she tells me when she was working in New York City that she was on the bridges, under the bridges, looking for people that had mental health. So she's been an on the ground worker. So that says a lot about her.
Absolutely.
Yeah, thank you.
Lucky
And
to have
Eileen's a
her.
nurse, so that sounds a lot. So we're simpatico. It's good.
Thank you
I
so
worked in the
much.
emergency room, so you know that was the entrance in.
See, I told you, this is great. Thank you both for coming on. Thank you, ambassadors, Families Together, everyone who is on listening, watching today. Paige, I'm just gonna turn it over to you to close and
Thank you, Mona. And
Thank you.
Commissioner and Assemblywoman, thank you so much for taking time out of your very busy schedules to, sit with us, to have dialogue with us, have dialogue with each other. I agree with Mona that the conversation between the two of you is especially, and I couldn't help but smile earlier when we were thinking about, we have a female governor, we have chairs of mental health committees in both the Assembly and Senate, and our commissioner are all women. And I think that there's something, we've come a long way, baby. And we're really fortunate to have empathetic, strong women leading our committees and our state agency and our state. And we thank you very much for your empathy and your attention to the critical issues that we've covered today and that we'll continue to cover with you, throughout session and throughout the upcoming year and beyond. We're very, very grateful to have you as allies and friends.
So I
Thank
want
you.
to add one more thing, Christina and Zach, and I don't mean to leave anybody out. Zach, you know what? I'm always open to listen for legislation, and you might be able to help me. And Christina, your son and his frequent attempts at suicide. I mean, you have probably better answers than I do. Christina, you can find me. I'm either in the Monticello office or the Albany office. I'm sorry, I look like crazy today. I just got over the COVID. So I've been home. Everybody has COVID now, but I feel good. I got less symptoms. But what I'm going to say is I'll be back up in Albany on Monday, Christina and Zach. And if you have any ideas for me, I'd love it, and I'm sure that I could get Ann to read it and make sure that what I'm doing is the right thing and we can get some do-re-mi. So I would, any kind of input, the best legislation comes from people that are down and dirty and really in that field or have experienced it themselves. That's really where I get most of my legislation from. So I would appreciate it. You can find in the Albany office. I'll be there on Monday. So if you want to call, I would more than love it if you did. So I could put in legislation that would really, help the mental health community. And I that's what I want to do. I don't like putting in, kind of bull kind of legislation. I want something that's down and dirty and going to help people.
And similarly, Christina, if there's anything I can do, if you want to give me a call and we want to talk, please do. I'll be glad to.
Definitely.
Please
Sounds
give
good.
me, please, do you want me to reach out to, we know.
Yeah, I can
I don't
reach
want-
out either way.
Okay, so we'll reach out. I'll reach out.
Behind us.
Okay.
Phone number so we can all call her.
We'll call you.
Yeah, no,
We'll get in
sounds
touch.
good.
We'll call Christine. Thank you.
I actually have the school on the phone now with a concern that
Okay.
I just
Okay.
think was
I'll
like,
give you,
hold on.
I'll give you a call. I'll give you a call.
Yeah, sounds good.
Bye, everybody. Stay safe.
Thank you, everyone.
Thank you
All right,
all.
thank
Thank you all. It's been a real pleasure.
All right.
Thank you so
Bye.
much. Take care. Bye-bye.